What we are presenting here is how to avoid, or if not avoid, perhaps relieve the discomfort caused by commonly encountered problems in the body that can occur with work in dental care or simply in living in our bodies in the modern world. Our goal here is to assist you in living more fully and comfortably in your body. What's presented should not be used in place of diagnosis and treatment. If you are experiencing discomfort or impairment of function, especially if it's asymmetrical and lasts more than a few days, please do the right thing and have a professional assess and guide you in the care of whatever the problem might be. And thank you for your interest in taking care of yourself so that you might more fully and joyfully care for others. After all, we're all we've got. My name is Dr. Mary Ann Ferda, Doctor of Chiropractic. I graduated from Palmer University, where I also was a professor for several years. I had the honor to assist in the development and then teach in the massage curriculum at De Anza College, because I think it's essential to maintain balance in the muscles in order to maintain balance in the skeletal system. Having traveled extensively in Asia, studying yoga in India, volunteering to teach English in a Buddhist monastery school, and most recently helping to treat earthquake victims in Nepal, have all confirmed for me the importance of maintaining and restoring the balance of the mind and spirit as well. To get us started, I wanted to discuss a few principles about how to maintain a pain-free body. But even before I start getting into jargon, let me say this. One thing that I find is extremely important for people to understand is that the body's meant to move. It's not meant to be static. Perhaps that's why it's so exhausting to travel. If we need to maintain a position for an extended period of time, like sitting while traveling, even just small movements can be really helpful in avoiding fatigue and avoiding discomfort. Okay, so that's the initial things just to keep in mind in relationship to all of what we're going to discuss subsequently. Okay, so now the jargon. Neutral. Okay, what I'm talking about when I talk about neutral is the neutral position of the joints. Okay, so for example, in the wrist, the neutral position is this. Okay, the back of the hand lines up with the back of the wrist. Okay, so in this plane, this is the neutral position. Okay, so it's not flexion, it's not extension. Okay, look at in this plane, neutral position is where the hand extends pretty much evenly on the thumb side and on the little finger side, as opposed to this or this. Okay, so the jargon: flexion, extension, ulnar deviation, radial deviation refers to the names of the bones. So keeping the joints in a neutral position, for example, the wrist, is a very good protector in avoiding discomfort and pain. So positions to look out for that can cause discomfort, as we were describing the wrist in extension. Okay, so holding the wrist in extension, for example, when driving a car, okay, what's the solution? Just be aware and avoid, right? Easy enough to hold the steering wheel this way than to hold it this way, okay? The wrist held in flexion, okay, as with using a dental tool. How many of you have been aware of this kind of position? Well, so what's the solution here? Simply by moving the body slightly, the wrist can come into a neutral position. Another position that we've already mentioned, the wrist in deviation, whether it's ulnar deviation or radial deviation. Here again, just an awareness of the slight correction can make all the difference. As we mentioned, moving the body slightly is a good idea for yourself as well as your patients. So it's real easy to just ask your patient if they would move slightly so that you can help yourself to avoid the pain and discomfort helps them as well. So in the shoulder complex, shoulder is actually made up of 4 different joints. So in the shoulder complex, the shoulder is meant to rest easily with the shoulder blade resting on the back of the thorax so that the collarbones can be open in the front of the thorax. Okay? The arm rests kind of like a gentle plumb line, a little bit behind the front of the body and in front of the back body. The most neutral position is that with the shoulder blade relaxed on the back body so the collarbones can be open and the arm just hangs a little bit in front of the back body wall in a gentle plumb line. The most obvious and prevalent distortion here is when the shoulders move into what we call protraction. Okay, now I'm making this really extreme. Hardly anybody looks like this, but this is what happens to make it obvious. The front body closes down, these get tight and short. They don't tend to be symptomatic. The back body is usually where the pain is because the muscles along the back and the upper back and in between the shoulder blades will become uncomfortable. It affects the shoulder itself because it distorts the muscles of the rotator cuff. The front ones get short and tight. The back ones get overstretched and symptomatic with respect to pain as well. Okay, so it can be easier said than done. So some focused stretching to allow that which is short and tight to get longer and feel better will make it easier to strengthen other muscles to maintain balance. In the spine, the head optimally floats easily in a balanced way above the shoulders. The shoulders rest over the pelvis, both in sitting and in standing. In a standing position with the knees relaxed, there's a gentle plumb line that goes through the body so that the weight of the body is balanced evenly between the toes and the heels and moves evenly to both feet, not on the outside, not on the inside, once again, balanced. Which brings us to the second principle, balance. A pain-free, fully functioning body is one that's balanced from right to left, from front to back, from inside to out. In sitting as well as standing, even weight distribution is key. Especially in our world with the myriad devices that seem to be designed to pull us off balance. Again, whether it's computers, cell phones, or even the tools of our trade. Mindfulness toward the balance can go a long way to helping maintain the balance. As the body moves off balance, some muscles have a tendency to get too tight. Other muscles that don't work have a tendency to get too weak. So, what everybody understands, right? So many people have low back muscles that are too tight. That's on the back. But does anybody have abdominal muscles that are too strong? So, learning a little bit about these imbalances can go a long way to helping to support remaining balanced or restoring the balance once we get a little bit off kilter. This maintaining balance can allow us greater freedom of movement, as well, of course, as freedom from pain. Fears about our interaction and our performance at work, or about our relationships with others, or even the fear that by moving easily we may cause some pain or discomfort that we have, can all cause us to stiffen our bodies and basically stop breathing easily. It can also cause us to hold more tightly on to whatever it is that we're holding on to, whether it's the steering wheel or the tools of our trade, or our cell phone. So, it may well be that the way to get a grip is to loosen our grip, relax, take an easy belly breath, and let go. So, in this segment, because we use our wrists so much, I'm going to talk about the wrist. And in order to discuss this most fully, I have brought my friend Huesudo, means bony one, to help us in learning more about the wrist. So here it is, ladies and gentlemen. The wrist, the bones of the wrist are actually in the hand, as you can see right there. So these are the carpal bones, okay? The so-called carpal tunnel. It's very cool. Look, you can see that's the tunnel, okay? So when we're talking about the wrists, we're talking about the carpal bones, and also we're talking about the radius and ulna and the fingers. I have some illustrations to share with you to get a little bit more information. So in this illustration, we can see both the arteries that provide blood for the hand as well as the nerves. This is the median nerve going through that carpal tunnel I showed you a minute ago, and this is the ulnar nerve that's traveling outside the carpal tunnel at the outside. This is the thumb side, this is the little finger side. Going from the 2D where we can see the ulnar nerve passing through the tunnel of Guillain, here it is, or here it is deep. I'm just showing you where it is deep in the hand, traveling through that tunnel. And here's the median nerve traveling through the carpal tunnel that we saw in Huesudo, and that's where the nerve passes through the carpal bones into the hand. Again, in 2D in this picture are all these little strings. All of these little strings are the tendons of the muscles which flex the fingers and flex the wrist. So the tendons are in there, they attach there, and the muscles are in the forearms. So the tendons that we saw going through the tunnel become these little strings that we can see in the front of the wrist and travel into the front of the forearm here. So the problems that can occur with the wrist, as we discussed in the introduction, is when the wrist is out of neutral. So stuck in flexion, stuck in extension, radial, ulnar deviation. All of those fixed positions may cause compression of nerves, may cause compression of blood vessels. Just the tightness of the muscles that we saw in the front of the forearm can cause the compression of the nerve going through the carpal tunnel. So the fix is keep the wrist in neutral. Keep a balance, relax and breathe. So the problems that occur in the wrist, most of them caused by the wrist being out of the neutral position, held in flexion, held in extension, held in ulnar deviation or radial deviation. All of these different distortions in positions over time can cause soreness, irritation. The irritation can cause the tendons to become inflamed. Inflammation of the tendons can compress the nerves. So you have symptoms, numbness, tingling, muscle weakness. Now, what can we do to fix these things? So the fix is relatively simple, right? You keep the wrist in a neutral position, relax and breathe. Now, so what do I mean by that? So often when we're holding on to things, again, holding on to the steering wheel, holding on to our cell phone, holding on to the tools of your trade, the death grip. You don't need a death grip. So a really simple exercise is something I like to call the queen wave. Now, you can laugh, it's fine, you can laugh at me. Don't worry though about your being laughed at when you do it, because if you do it in the office, people look at you, what is she doing? This is what I refer to as the queen wave. You can see that the forearm is perpendicular to the earth. Okay, if it's a little bit at a slant, that's gonna not allow the freedom of movement of the wrist so much. So forearm perpendicular to the earth, the fingers are pointed up but not stiffly, and the fingers are moving, the hand is moving, the forearm is all moving together into a gentle pronation and supination. This is a way to relax the muscles of the forearms, get the blood that's collected into the fingers out of the fingers. And it feels so good. You might just relax and breathe as well. Another important thing that we talked about is, when would you do this, right? When you notice that your forearms are getting tight, when you notice that you're feeling tense. Like in between patients is a great time to relax, breathe, shake out the hands, get the blood out. Just let it go. In this segment, we're going to be talking about the muscles in the forearm, and specifically the muscles in the anterior aspect of the forearm. So here we can see, again, the right hand. Here's the arm in 3D. Here's the arm in 2D with the superficial muscles of the forearm there. There's that median nerve traveling through the tunnel. There's the ulnar nerve traveling through its tunnel. In this illustration, we can see the deeper muscles in the forearm so that you can see how the ligaments cross and help to support the wrist. So the deeper muscles, the more superficial muscles. These are all flexors of the fingers, makes a light fist. Flexion of the wrist brings the back of the hand away from the back of the forearm. Problems that can occur in the flexors of the wrist and the fingers, obviously holding too tight the instrument is going to create tension in the forearm. Tension in the forearm, muscle tightness, soreness, pain, irritation. Compression of the hand over time can cause compression of the nerve by tension in the muscles, even by wearing gloves that are a little too tight. You might compress something that you might not want to compress. Compression of the muscles. Well, where do muscles get tight? They get the tightest where they start. So you can get pain here from tightness through the whole body of the muscle. What are the fixes? Keeping the wrist in neutral position if the muscles are too tight is not going to help. So yes, you want to keep the wrist in a neutral position, but you want to avoid the death grip, okay? And even if you avoid the death grip, even if you relax the muscles periodically, it may be very helpful to stretch the muscles.